Social isolation, anxiety, and even fear. Some of the feelings healthcare workers are experiencing on the front line of their fight against COVID-19. To help, Singapore's hospitals are boosting support for their staff. The aim is to ensure they don't get burnout from the added pressures.
This outreach group is a new initiative rolled out at Khoo Puat Hospital. Held 3 times a week, such sessions are led by specialists ranging from psychiatrists, psychologists to counsellors.
There are several purposes to it. We go in with the aim of sharing with them what we know about how to cope with stress, how to recognize stress, and also get them to share with us what they are facing on a day-to-day basis, right? What they surface to us, oftentimes we would process it, we'll collate it, and if necessary, we'll do advocacy for them.
These groups come under the hospital's Peers Around Lending support, which has been in place for more than a decade. Conceived post-SARS, the so-called PALS program draws from the experiences of healthcare workers during and even after the 2003 epidemic.
After SARS, even after the event ended, people were realizing that healthcare workers were still affected by how difficult it was, right? So some studies started coming out, and we also realized that there's a need for more systematic staff support several years after the acute event ended. So people were reporting things like, for example, heightened stress level, sometimes probably even like PTSD kind of symptoms.
The program also provides a support helpline and an email channel, which allows staff to access a trained peer supporter. Over at the Singapore General Hospital, there's also a similar support program called Support Action for Employees, or SAFE. Besides running peer support groups and an email service, SAFE has extended the operating hours of its helpline to 7 days a week from 5. Many SGH staff members have also come forward to join the network.
They will actually learn about So how do they look out for signs of distress, signs of stress? Okay, then we will actually have them to listen. How do they actively listen to their fellow colleague who actually approach them? How do they listen out to the different signs and symptoms? Okay, and how can they link to the relevant resources, be it professional services like staff counselling?
While the primary objective of these networks is to create a culture of care among staff, the aim is also to build resilience across the hospitals. Which is why Tan stresses that all support given is kept confidential and that fear should not stop anyone from seeking help.